Hospitals in Europe are packed as the region deals with the resurgence of COVID-19. Millions are living under lockdown again. While that's brought daily infection rates down, there are fears healthcare systems still won't be able to cope. Lucy Hoff reports.
The second wave in Europe has been more brutal than anticipated, eclipsing the first wave in the spring. For weeks, medics at this hospital in Liège have been battling an influx in COVID-19 patients. The ICU ward has been at full capacity since October. The severity of the illness means just half of those treated here make it through to rehabilitation. Some patients have been transferred to other regions, even across the border to Germany, to reduce the strain.
We still are at saturation. And for example, in my unit, we have admitted 13 new patients during the last 24 hours. And the situation is still very difficult with patients that are not able to be sent to other hospitals because they are too sick for transportation.
The fresh wave of the pandemic has taken a heavy toll. Even as the onslaught of infection begins to wane in Europe, the WHO says someone is dying of COVID-19 every 17 seconds. National lockdowns mean the curve is beginning to turn, but the health and economic crisis will continue over the winter months. Economists say hundreds of thousands of local businesses won't survive. There had been a recovery in the summer months as economic activity resumed and high streets like this one reopened, but that's been cut short by the rapid spread of the second wave. Europe's economy is now heading towards a double-dip recession, with growth in some countries turning negative in quarter four. The good news from vaccine trials provides some hope, with the EU preparing to administer the first doses by the end of this year. Brussels has signed deals with 6 pharmaceutical companies to secure millions of shots to be distributed across all 27 member states. Health workers and the most vulnerable will be prioritised. The EU is also working to better coordinate testing strategy across the bloc. The rollout of rapid antigen tests could allow travel to resume in 2021 and reduce the need for 2-week quarantine rules.
The turnaround time of the results is much shorter than for a standard PCR test, where it can take from 24 hours to several days to return the results. We also think that there could be benefit of using these tests for repeat testing of healthcare workers or in closed settings to screen.
The lights and decorations are out, signalling the arrival of the festive period. But Christmas will look very different in Europe this year. Countries like Germany and Italy are allowing a short amnesty over the holiday period to allow people to see loved ones. But the loosening of the rules could come at a cost in January. As Europe continues to battle with high infection rates and with a double-dip recession looming, the bloc cannot afford a third wave in the new year. Lucy Hoff, CNA, Brussels.